Hello, my name is Tiffany Panza, and I'm going to talk to you about some trends in professional nursing. So, I believe that the trend of SBAR will have an impact on my future nursing practice. I am a big believer in giving an effective handoff report that is not too long and not too short. And I do believe that SBAR is an effective framework in which to give an ideal handoff report. SBAR helps me organize my thoughts quickly and focus on the bullet points so I can give a brief, effective report to a nurse or call a doctor and ask a question, or another provider and ask a question on the phone. I also believe in closing the loop and repeating back the provider's instructions after I receive an order. This seems like an excellent way to save time and prevent errors for all members of the interdisciplinary team. Because whenever we can catch and prevent an error early in the process, it saves not only a possible error for the patient, but it also saves a lot of time for all of the members of the team. And I also think another trend that will have a great impact on my future nursing practice is the trend of bedside shift report. And I have mixed feelings about the bedside shift report. I think it is wonderful because it gets the patient and family involved in the patient's own care, and it helps prevent errors, and it results in better and more accurate handoffs. The major downside to the bedside handoff is that it takes a long time, sometimes a full hour or longer, to do when a nurse has a load of 4 patients, and especially if you're trying to do handoff with 3 or 4 different nurses in 3 or 4 different patients' rooms. But it seems to be a trend that's here to stay. And because it does take so much time, I think it will have a huge impact on my life and my future nursing practice. Evidence-based medicine is another trend that's here to stay. I think that evidence-based medicine, for the most part, is a good movement. I think we should have reasons, that is, evidence, for doing what we do. And evidence-based medicine can help make me a more confident nurse when I'm a new nurse and might be struggling to learn some of the basic skills. However, when I stop and think critically about it, there are some downsides to evidence-based medicine. While it is wonderful to have guidelines to treat diseases, there is a certain art form to nursing, and nurses must be able to recognize nuances among patients. There will always be outliers who do not fit into the boxes established by evidence-based medicine. Another problem is the way research is conducted in this country. Most research is conducted on populations of white, middle class, and upper men. So depending on the topic or the medication, evidence-based medicine may change or may be inaccurate, and we may find more inaccuracies with it as the decades go by, and I hope that we start to do more research on not only women, but also different ethnic groups. And it will be fascinating to see what new trends emerge in nursing as the country changes culturally, socially, and politically in the next few decades, and also to see how healthcare changes in those same ways. Another trend that I think is here to stay and will impact my future nursing practice is the culture of patient safety and the idea of improving systems. I do not believe that blaming individuals for making mistakes is an effective form of punishment, and it makes a lot more sense to work towards improving systems that prevent mistakes. We should all strive for the highest standards when it comes to patient safety. But we also have to be realistic about the fact that errors are inevitable, and we need to look at ways in which we can set up safeguards in the system to prevent more errors. I think in my role as a member of the interdisciplinary team, I don't want to waste other people's time. For most of us, our time is our most valuable resource. It's a non-renewable resource. So when I reach out to colleagues with questions, I want to be friendly and polite, but I also want to respect their time by being informed and prepared about whatever topic I'm approaching them with. Another important trend that will have an impact on my future nursing career is the trend of accurate documentation. It seems silly to say this is a trend, as documentation is nothing new, but as we learned in professional nursing class, nurses are being held more and more responsible for accurate documentation than ever before. Charting is a huge part of a nurse's job, and the time management skills that it takes to be a competent nurse and to chart everything accurately require both skill and experience. However, I take this very seriously as I will be a licensed registered nurse, and it is my responsibility to provide competent care to my patients and to chart things in real time whenever possible. In closing, I would like to say that the reason I want to practice nursing is because I enjoy helping others and I love to teach people about their health. I would like to empower others to take better care of themselves and those around them. Thank you for watching my video.